used to regard soda as a treat, sort of a liquid candy, something they would get on a date or for a good report card. Now soda isn't a treat. It's a beverage many choose over water. People consume too much soda in the United States, and this has caused an unhealthy population and an increase in government spending. I know people who have struggled their whole lives with obesity, and so when I see commercials on TV for young people eating junk food and drinking soda, I really wonder if we're giving these products a reputation they don't deserve. Are we allowing these products the opportunity to misrepresent themselves to America, the way that we let big tobacco do the same? Some studies are comparing the situation, and they say though it's different, there are certainly similarities. A tax on soda would help create change in how people think about sugary beverages, provide support for healthcare system, and contribute money to programs that educate on the importance of nutritional health. Soda and sugar-sweetened beverages are large contributors to the obesity epidemic, and they should be held responsible, at least in the public eye. Let's face it, sugar is unhealthy, but still consumption continues to rise. Sodas contain between 30 to 50 grams of sugar, and the average 8-ounce serving of Coca-Cola has 97 calories. Some of the higher-end, high-caloric sodas are Mr. Dew, Mountain Dew, and Bark Street Beer, and they both top 150 calories per can. But in spite of the words right on the can, soda consumption has increased steadily for the past 4 decades. According to a study, the calories from beverages significantly increased between 1965 at 11.8% to 2002 at 21%. It's almost doubled in the past 40 years. Taxation in tobacco products caused a domino effect in how people view those products. And this is just what will happen if we tax soda. Taxes have continued to rise on tobacco products for the past 15 years, and in that time we've seen a huge decrease in smoking. These taxes are discussed in the news, and we hear the discussions by professionals about how bad they are, not to mention that money used from taxing tobacco went towards public campaigns and television advertisements about how unhealthy smoking is. Phone numbers of who to call when you're trying to quit and for support are all up there. And I think that was a very smart use of the money. And therefore, the same method can work again and should be employed. Talking about soda with the same disapproval as we talked about cigarettes will create the stigma and reduce consumption. So soda is a major cause of health problems and should be taxed to create that stigma. With obesity beating out tobacco as a leading cause of death in the United States, how are we going to afford the indigent care for these individuals? The taxation will provide that much needed relief. The healthcare system, when caring for individuals with heart problems and diabetes, the cost of caring for the indigent obesity-related conditions will be a huge burden on the taxpayers. 16% of American adults are uninsured, according to the Gallup poll of 2009, and Medicaid and Medicare pay for half of the health problems occurred in the U.S. The New England Journal of Medicine said consumers do not bear the full cost of their consumption decisions because the contribution of the consumption of sugar-sweetened beverages to obesity, as well as the health consequences that are independent of weight, the consumption of sugar-sweetened beverages generates excess healthcare costs. Medical costs for overweight and obesity alone are estimated to be $147 billion, or 99.1% of the U.S. healthcare expenditures, with half of these costs paying for publicly by Medicaid and Medicare programs. Sweetened beverages have caused this increase in obesity, and the taxation would just rectify the added expense in our systems. The substantial revenue from the tax increase could also provide the nutritional educational resources we talked about with the big tobacco programs. The revenue from the taxation would be substantial. In a study done, it shows that a national tax of 1% per ounce on sugar-sweetened beverages would raise $14.9 billion in the first year alone. Tax at a state level would also generate considerable revenue. For example, $1.8 million in California, $183 million in Oregon. The revenue would be directed at childhood nutritional programs, as stated by the article in the New England Journal of Medicine. The revenue generated from a tax on sugar-sweetened beverages would be considerable and could be used to help support childhood nutritional programs, obesity prevention programs, or health care for the uninsured, or to help meet general revenue needs. The substantial revenue from the taxation of sweetened beverage would help cover the costs of people affected by these products and support educational resources for a healthier population. We've discussed how obesity is a real threat to the American population and how soda and sugar-sweetened beverages play a large part in obesity. Changing the way people view these unhealthy products is the first step in recovering from this epidemic, and the taxation would not only bring about awareness, but also provide funding for the nutritional awareness. This tax could also provide the funding to cover medical costs for those affected by obesity, and this tax is really a win-win for society. The tax doesn't mean you can't drink soda any longer. Everyone still has the right to free will and free decisions of what they want to eat and drink. We all will be forced to face our bad habits, though, and maybe this will limit our consumption of these products. I would personally like to go to an old-fashioned soda fountain and get a root beer float on date night and have it be my whole month of soda consumption. And if I'm that responsible in my intake, seriously, what we're talking about here is 15 cents.